Whoever comes up with the silver bullet for that will do very well because that is such a common refrain amongst patients and especially people who are not ready to seek surgery yet.
So what they're doing is they're combining two different things, chemicals or biologic agents or both, into one filler syringe.
Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome back to the Beauty Scientists. I am Dr. Kristy Hamilton here with my amazing colleague, Dr. Roy Kim. We are both board certified plastic surgeons, and today we are talking all things South Korea, aesthetics, plastic surgery, because Dr. Roy Kim just got back from Korea Derma 2025, and that means he has a lot to share with us in the Western world. So welcome back, Roy.
Hey, good to see you as always.
Always. So Korea is always ahead of the game when it comes to skincare. I think especially like injectables, facial aesthetics, and they get to play with some of these products a little bit faster than we do here in the US. So fillers is always a major topic. What's the state of the art with fillers in South Korea?
I think the big thing is what they call hybrid fillers. So what they're doing is they're combining two different things, chemicals or biologic agents or both, into one filler syringe. So what that allows is not only contouring and filling, but a lot of times if it's just meant for contouring, your skin looks better. If it's just meant for your skin like a skin booster, your skin looks really better. And that is really the concept. Closest thing we have in the US is called Bellafill, which is not the world's most popular filler, but it's been out for a long time. FDA approved. The cool thing about Bellafill is that it lasts for 5 years, but it actually has two products. It has collagen, which works immediately, helps with the contour, but doesn't last that long. In the meantime, the other filler material, PMMA, polymethyl methacrylate, that substance in tiny little balls or microspheres induces collagen to grow. Now, it's not going to do it immediately. So for the immediate result, patients see the collagen. As the collagen degrades, the PMMA starts to kick in and your own body's collagen grows where the PMMA microspheres are.
Okay, so that's great because patients come in, they want to see an instant result, and then they also want something that's going to be long lasting so that they found a way with that hybrid approach to get patients both.
Right. And so we could replicate it. I think the easiest example is we're already doing hyper dilute Sculptra or hyper dilute Radius. And instead of contouring, we're making it really dilute and injecting it all over the skin to help your skin glow. In Korea, they've done the next step. They get Sculptra equivalent or Radius equivalent, and they're mixing it with HA filler in one syringe at the factory, and then they're releasing it to dermatologists. So you actually get the glow, if you will, of immediate HA. The HA gives you very quick glow, like within a couple days. And the Sculptra equivalent or the Radius equivalent gives you that longer term thing where your skin looks better after about a month or 2 or 3. And it lasts, 6 to 12 months.
Are these being injected in the face like to sculpt in the way that we use fillers here? Or are these being like injected into the skin itself for like the skin booster effect or both?
It can be both. It depends on the actual product. So if it's just pure skin booster, yes, it's injected just underneath the skin, like less than a millimeter thick or deep. And usually it's hard to do manually, or it's annoying to do manually because it's hard to get that consistency. So they have special devices that can inject it, 50, 100 shots in your face pretty efficiently, but just underneath your skin. They do have a couple really cool HA fillers that are dual weight, low molecular weight and high molecular weight. So that means if you have a contour like your nasolabial fold or your cheek, that helps with the contouring, it helps fill in a deeper wrinkle. But then the low molecular weight HA filler actually brightens your skin and helps it glow immediately.
Wonderful to hear. And as soon as you get that injection gun in San Francisco, right, just know I'm on the first plane. I want to be patient. That's so neat. Okay, so It's similar to we have like different viscosities and different products meant for different areas, whether when we're making bone or fat pads or something really superficial for the skin. And so they've blended all of these and they similarly have ones that are appropriate for different places. What about in the land of products that are biologically derived, like what we have, like our Renuvas and Aloclays of the world?
So they have something slightly different. They have, just in case our viewers or listeners out there, Dermaclay, Aloclay, Renuva, that stuff is actually fat derived from cadavers. They have something that is either extracellular matrix, and to be honest, it sounds very similar to acellular dermal matrix. So these are products that, again, they're derived from human cadavers, but it's not fat. It's usually dermis or the scaffolding around the skin. What they've done in Korea is that they're extracting that. They're micronizing it, so they're chopping it up into really fine powder. And then either you mix it or it comes pre-mixed and you inject it into patients. What the advantage is that since it's human tissue, it responds very well in terms of not forming lumps, getting integrated very quickly, having collagen form very, very quickly because it's natural. It's what they call it is it's someone else's skin into your skin. And this is really awesome for the tear trough. They're very happy with it. They think it's far superior to HA filler.
That's a very unforgiving area to inject. So that's really interesting that that's like the favorite place.
Yeah, I mean, we have PDGF, which is controversial. We have HA fillers, which are totally FDA approved, but sometimes problematic, especially in patients who have a lot of lower eyelid swelling. So they're reporting very little long-term lower eyelid swelling with use of these biological products, specifically micronized ADM.
Really interesting. It'll be good to hear more about that. The under eye, yeah, what comes up with the silver bullet for that will do very well because that is such a common refrain amongst patients and especially people who are not ready to seek surgery yet. What about the salmon DNA? We all want to know the latest in the salmon DNA. We all
So
want it.
this is going to be good for patients out there. We still don't have true salmon DNA injectable. So in other words, we don't have the more robust injectable that's FDA approved in the United States. We have maybe, I wouldn't say wimpy, maybe like a smaller version of it available in the US. The good news is that the more robust injectable, it's very, very safe. This is why it's so wildly popular in Korea. We all know that with any filler, there's theoretically a risk of vascular occlusion. Well, this is, again, injected as a filler, or it could be injected as a skin booster, both. But because it's so close to human DNA, I actually did a literature search. I didn't believe them. The Korean dermatologists told me they have not had a single case of vascular occlusion in Korea yet. And it's been out for a couple of years. So they're pretty confident that it's like, in terms of just the size of the particle, as well as the fact that it's biologically based, it's a very, very safe filler generically.
So, and is it a good volumizer? Is that like not what it's intended to do, or more of the biostimulatory, build your own collagen, enhance your tissue type treatment?
Probably a little of both. I mean, it does give you volume. It can contour your face. That's the stuff that they have in Korea that's not FDA approved yet. But having said that, they're not reporting like lots of injuries or long-term healing or vascular occlusion events with that more robust filler material, specifically salmon sperm DNA.
That's fantastic. I mean, anything you can do that reduces the complication rate to 0%, that's a win in my books,
Yeah, I
especially
think so.
when people are offering these treatments now with varying degrees of training.
I totally agree. I think it's really, really remarkable that they've reported that so far.
May it stay that way. And my favorite that I wanted to ask you about, tell us about the spicules. What is a spicule?
So the spicules are like little shards of seashells, if you will, or little like crumbs that are slightly hard. Now they're very tiny and it's mixed, either you put it on a little mask or you can actually mix it in with lotion. So if you feel it as a lotion, it feels like fine grains of sand. I would say it's even less than 5 grains of sand, but it's not smooth. It feels a little grainy. And so one option is to just use that sort of in semi-lotion form, and it doesn't cut the skin. You're not going to get bleeding. But because it causes mild indentations or minor trauma to the skin, it's actually able to deliver whatever chemical substrate you want from the lotion. The other option is actually to, clean your face, whatever, and then put on these little spicule masks. And again, if you rub your finger on it, it's not sharp, but it is slightly like rough pebbly, if you will, maybe sandpaper. So there's no pain. You just press it into your skin, specifically on your face or in the under eye or around your mouth. And then your skin actually has better absorption of whatever chemical you want.
So it sounds like it's both a drug delivery system, like in terms of making those micro injuries, and then also acting like a independent collagen booster itself, just by creating those mild micro injuries and
That's
stimulating
right.
your production. That's a nice dual purpose.
As well as it's available to consumers. Like you don't need to see a doctor. You don't need like a med spa or a nurse or doctor to actually deliver this. It's not microneedling, which causes like little tiny holes and bleeding. Microneedling, of course, is more effective, but you can't really do it at home as a consumer. Whereas the spicules, you can do it at home as many times as you want.
It's really great. I mean, patients want small versions of these procedures for things that they can do for their ongoing maintenance. And they're coming in and seeing us for like the bigger things. So this can keep them going in the meantime.
Yeah, I think it's great.
And I know something you talked about frequently in the past is like when you go to these dermatologist's office, or plastic surgeon's office, like you're usually not coming in for one thing. Tell me about the power of combination therapy in South Korean beauty.
Yeah, that's not something we think about a lot in the US. I think it's just we're not trained to think about it, plus the cost. In Korea, they look at your skin very holistically. So they're going to want to make sure your skin quality, the way your skin looks like right now, looks better. They're going to want to deliver things that help your skin look better underneath the skin surface. And if you need contouring, they'll do that as well. So, in terms of obviously skincare, there's prescription grade skincare, there's your own skincare, but they have a lot of skin boosters, which we only really have one FDA approved skin booster, SkinVive. Moderately, of course, like just underneath the skin surface, but definitely underneath the skin surface, we can give Botox to wrinkles. We can have sort of some type of ultrasonic therapy, including SoftWave and a couple other competitors. I would say weaker lasers. In other words, a laser where you don't need one treatment. You may need 2 or 3 treatments. That's the level that they usually work at. And even RF microneedling. And the deepest layers, of course, you get the laser blast. In other words, something that you may need to recover for 4 days, a week, but that's meant to be just done once in a while, and that requires one laser treatment. And then some of the deeper RF microneedling devices, they definitely go to this layer as well. And of course, deeper layers include filler, like if you have a deep wrinkle somewhere. So in one visit, you're going to get all this stuff done. And I think Korea technologically is probably much more advanced in terms of skin booster and a much lower cost.
Remember you said you would go from like room to room to room. It was like this wonderland of like skincare and improvement. What's behind each door as you go.
They have the volume and they still treat patients well, and they're still like nice and luxurious places, but it's very foreign to Americans. Like if you're at some big facility and you're just going from room to room to room, I think that maybe Americans could get used to it, but also I think that you would be wondering, is the dermatologist doing every single procedure? And the answer is no, because the dermatologist or doctor, they're like one doctor's running the laser all day long, the other doctor's just doing filler all day long. That's massive volume. And I think very few cities in the US currently could sustain that volume.
Yeah, it's just so much more part of the routine. But that's why everyone's skin is so green in South Korea. Right.
It's pretty normal to go to that sort of treatment, maybe like 2 to 3 times a year. Certainly once a year is the minimum, and a lot of people do.
Yeah. Amazing. Well, that's why they look the way they do. I mean, a glass skin is habitable. It looks amazing. And any other new devices or technologies that you learned about while you were there? Anything you're excited about?
I'm
Whether or not
excited
it's
about, yeah, I mean, I'm very excited about this piece of technology, Double Tide from Agnes Medical. I think the problem is that I don't know if it'll get fully FDA approved. So this is a dual device. It does 2 things. 1, it's a great skin booster injector. 2, it's a great RF microneedling device. So the US has plenty of RF microneedling devices, and the FDA has actually approved that. The FDA has not approved the skin booster injector portion of the device because really the US doesn't have any great machine type skin boosters, injectables. It looks like a little gun. You load it up with fluid, skin booster, and then you inject it in the face. Double Tight, when it works, and it's been in Korea, Asia, Europe, it's fantastic. The issue I think with the FDA is number 1, it's a newer device, specifically the skin booster injector part. Number two, the FDA does not like it when you have a dual device. They'd rather have two separate machines or two separate devices. I don't know if it'll be approved. I don't know whether they'll have to separate it. I also know that it's cool in technology because if you think about it, skin boosters placed just underneath the skin. And RF microneedling is definitely done a little deeper. They've done the synchronization, the timing, so that the RF microneedling is not heat, in terms of heat, blasting the skin booster, altering the properties, like melting it or whatever. So it's very cool technology, period.
You don't have as many needles, like pain-wise, you control that, right? Because it's like you go in, you heat, you read the appropriate time till it cools, and then inject.
Yep,
Is that
that's the other cool
concept?
thing.
Yeah, I
A
mean,
lot fewer
anything where you're
shots.
not, yeah, anything where you're not having to inject patients more often than they need to get the result, that's going to cut the distance down by half, for example, with that.
Yeah, I mean, it's technologically very slick. I just wish I knew someone at the FDA. I guess I could bribe them and then like get some money from Agnes Medical, but that's the issue currently.
Anything's possible at the FDA right now. We'll see. Maybe it's possible. We need to get some people in there that are very interested in skincare, and maybe that will do the trick. That's amazing. So always something new, always something exciting. I know we blend up a lot of our own blends of these filler combinations, and I know Allergan has Harmonica coming at some point, which is that like a hyperdiluted hyaluronic acid equivalent coming in the next couple of years. Probably that'll be our first official blend. But it'll be nice to have these like formalized and not have to DIY it like we currently do.
Yeah, I mean, it would be better if we had one filler syringe that had both products inside of it.
Really exciting. So any parting thoughts on the future, or were they giving any idea of like future direction in South Korea, like what they're excited about? Maybe even things that don't exist there, they're hot topics.
The skin booster's big there. They want to make it even bigger. Right now, interestingly, most skin boosters still injected manually. They really feel strongly you get better results if it's done with a machine. And so they're doing studies to show that. And hopefully they'll be able to bring more medical devices from Korea to the US. So of course, there's always China. There's a lot of competition from those medical device and laser companies. But Korea actually has an industry of making lasers, medical devices, RF microneedling devices, other things. So they have the technology. And I just think that Korea, for better or worse, has a very good reputation in K-beauty and plastic surgery and dermatology products. They just have to get, FDA approval for those devices.
It just takes time and money for sure. But it's inspiring. I love that you get to go over there and attend these. I love that you're lecturing over there. It's incredible. And how lucky are they to have you, and how lucky are we to have you to learn about all this on the other side of the ocean.
Well, I definitely need to, you and I both, we'll talk secretly about how to bring some of these more advanced techniques into the US.
I know I want the injection gun into the skin. I need it somehow. We'll find a way. So amazing. I hope you all learned something. I know I did. I want the spicules. I want the injection gun. I want the skin boosters. And if you have any questions or topics you want us to discuss, leave a comment below. Message us. We are the Beauty Scientists, and stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.